Hi, I'm Dr. Newman, and I'm a plastic surgeon, board certified in Murrieta, California. And I'm here with one of my patients, and we're talking about breast augmentation with implants. I think there's a lot of information out in the media, and even doctors purporting information that the type of the implant is what determines the patient's appearance. While I agree that this is part of what achieves a good cosmetic result, it's probably at the bottom of a long list. The most important thing for me in achieving the correct size and shape is the person's own anatomy. And that's why I think it's important to customize the procedure to the person's own wishes, needs, and of course their appearance, their anatomical landmarks. I think one thing that I do that makes me separate from other plastic surgeons is that rather than patients pick the size that they wish, I have them give me some latitude and I perform a sizing during the surgery. How do I do that? What I like to do is to mark the edges of where the breast should come out to. I then make the pocket at surgery, the space that the implant will exist in, underneath the muscle, out to the edges, for example, to achieve cleavage, to get out to the edge of the chest, and to get fullness in the upper pole of the breast, while at the same time preserving the fold underneath the breast, because this supports the breast and provides for fullness that the implant achieves. Once we perform an intraoperative sizing with a saline sizer, which is a saltwater implant that can be filled to any volume, we sit the patient up when they're asleep. We sit the patient up so that they're bolt upright on the operating table and in 90 degrees, and fill the sizer until it's completely full. Once it's filled, we measure the total volume that's required to give a good cosmetic shape. We then have the patient lie down on the back of the table, and we pick that size of implant that will completely fill that space. This, I think, achieves the best cosmetic result for the patient's own anatomy.